So the common question your patients might ask is, can filler move? So what actually happens with dermal filler is that you inject it into the tissues, and it's basically a long chain sugar molecule, hyaluronic acid. And in the first few minutes to hours, it starts to get tangled up with the existing molecules in the skin. That's collagen, elastin, your gamma aminoglycans. Basically, it gets tangled up and it moves much less easily. So can it still move? Yes, because I know if I see a patient back with maybe a little lump or something, you can often massage that away within 2 minutes of them returning 2 weeks later. So that means filler is mobile. But I don't find that it's mobile enough that people have to live their lives around it, with the exception of the first couple of hours after the treatment. You want to be really cautious, probably even the first 48 hours with some products, that you try your best not to put any pressure on it, and that will just help it integrate into the tissues and stay put for longer. Having said that, we do know from Dr. Master's discovery with ultrasound that some filler will still be present and will be slightly diffused from the place that was originally put, even 3, 4, 7 years after the treatment. So the answer is yes, it can. And actually, instead of denying the possibility altogether that it will move, it's a good idea that patients know that it's possible that it can shift slightly over time. And that's why maybe every 2 or 3 years in certain cohort of patients, not in everyone, you might need to start fresh. Diffusion is possible. It's not a big problem. It's not as big as you might think, but it is possible. And other places that can make it move will be anywhere where there's lots of movement. So if you've done lip treatments, occasionally you get a little bump on the oral commissures. That's from repetitive mastication or movement that causes a little bit of collection of product. That's another reason why you occasionally get the sense that products are moving, is just because the face is moving and you get little focal points of high pressure where the filler seems to drift. But that's a much smaller problem than the diffusion over many years. I think that's more common. So it's possible, not a major problem, but your patient should be aware of it, and you should be aware of it so that you can look after them in the long term. Hope that helps.